Greetings. This is Toni Ellis, Soul Sparker and Clarity Coach. We are a couple of minutes later. I think maybe a few minutes late. But this is your Medical Mondays with Monty. And so this is my husband, Lamont Ellis.
I'm Monty.
And as you saw from what we put in the title, we're going to talk about the truth about narcotics, you guys. Hi there, Mia. How are you doing? Welcome, welcome. So thank you for joining us here this evening. We will be here basically every Monday. We're going to be in London this week. We leave on Thursday and we don't come back until, I believe, next Friday or next Wednesday. I can't remember which day. But so we may miss next Monday. But this will be a regular offering. And my husband is a physician who just wants to help you to improve your health care and become your best advocate in health. And what else, baby?
Well, part of it's just navigating the healthcare system. Working as a clinic doctor and a hospital doctor, there's so much confusion out there, you know. And a lot of times people are asking me, why did my doctor do this? Why did he prescribe this? What was the thought process behind some of what's going on? So, you know, I'm here to give some perspective from a physician's standpoint. You may not agree with it, you may not even like it, but, you know, there's a method to our madness sometimes, and that's what I'm trying to do, just give you some insight from the other side.
Indeed. So before he gets into this discussion about narcotics, I'm going to give you a little bit of my history with narcotics. So I can tell you that when I was about 24 years old, I experienced a hysterectomy. And during that time, I was in a lot of pain, so they prescribed me some pain medication. But I was in more emotional distress than I was physical distress. So I ended up saving my prescription drugs that were supposed to be used to manage my pain to instead later on manage my emotions. And I started taking my Lortab or my Percocet and saving them, and then having a drink with them. And yes, I was a regular church goer, even served in the church very faithfully, but I was still doing drugs, prescription drugs, so they were legally mine, but I was mismanaging what had been granted to me for a time and a season. And so that is my introduction to narcotics.
Okay. Mm-hmm. I don't have much of a narcotic history. I've had narcotics twice in my life, both related to surgeries I had. Like the worst pain I've ever had, I think, was when I had all four wisdom teeth taken out at the same time. So I had Tylenol with codeine, and it took the pain away, but since I was pretty much opioid naive, it knocked me on my butt. So I had to be careful taking that. So I've been fortunate, though. I haven't had a ton of surgeries. I haven't had a lot of issues to need chronic pain medication. Tylenol does it for me for headaches. Ibuprofen if I have any sort of joint aches or anything else like that. So I've been very fortunate. But people I take care of in the hospital and even in the clinics are not so fortunate. That's what I want to just talk briefly about today.
Yeah. So by the time I met my husband, you know, he can prescribe anything to anyone. But by the time I met him, I was definitely not dealing with any type of narcotics any longer. And we find ourselves in the history of our world, and especially here in the U.S. of A, an epidemic.
Correct. So it's the problem with narcotics is, well, two things. Number one, no one intends to be dependent on narcotics. That's not what you set out to do. It happens because something occurs in your life, either a chronic disease process, or a lot of times I hear the story, it's just an accident, a car accident, or a slip and fall injury, or a surgery, whether intended or unintended. And what happens is simply you need that medication because the pain is so great, you're not going to get by with relief with taking simple things you can get over the counter. So it's given to you as a prescription for the best of reasons, because no one wants to see you in agony and suffering. What happens if you have chronic pain as a result of your surgery or of your accident or something else chronic for a chronic medical condition, it ends up being something that you become dependent upon. And it's, you know, the intention is the same, but your body has no way of knowing the difference between narcotic medications prescribed and illegal drugs out there on the street. Your body doesn't know the difference. They're both opioid types, and you have receptors which respond to that. And so the tragedy of narcotic medication is, the notion is somebody who is on narcotic medication chronically has got a drug problem. You know, they might even say they've got a bit of a dependency. Some people say they're junkies, whatever the case is. In the hospital setting, these are the hardest patients to take care of because you want to try and help with their pain symptoms. So they have a very high pain tolerance. So what ends up happening is you need to give a lot of medication to help people, and it's a difficult issue and problem. So that's kind of the perspective I'm coming from in terms of the prescribing doctor.
Okay. So I've expressed to you all that, you know, I had a bit of a narcotics issue at one point in my life, in one season of my life. And futuristic, this is hard for me to actually say. I realized how difficult this was going to be to kind of talk about it. I was using it to manage my emotions. And so when I found myself, because unlike him, I've had several surgeries. I've had a jaw broken before. I've had an appendectomy. I've had a hysterectomy. I've gone through multiple procedures on different levels. And people always talk about, you know, being put to sleep. They're afraid of being put to sleep. I welcomed it because my brain doesn't turn off as easily as some people. It's constantly going. And I have like a little bit of tinnitus, so I have ringing in my ears constantly. So to be put to sleep is like the sweetest rest I've ever received. And so over the years, I would save my medication for the times when I just needed to check out emotionally. And so because I could take pain. Pain wasn't the issue for me. I'm kind of used to pain. And I might even be one of those masochists that kind of appreciate pain. I do have a few tattoos, you guys. And I've had the tattoos without getting any type of help to numb the pain. So I don't know if this is a touchy subject for you, if you have had difficulty with any type of narcotic, be it legal or illegal. But I understand how easily it can be for you to become addicted to a situation where you use it as a crutch. And he wants to express to you why, you know, the truth about narcotics, why you should abstain as much as possible. Because now we're in a season of you being labeled. It's being watched very closely and managed very differently. You know, when I first married my husband, I had a bunch of friends that were dealing with chronic pain. And by then, like I said, I was done with narcotics. And I lost a lot of friends because they'd call me and see if my husband could prescribe them a controlled substance without seeing them, without knowing what's wrong with them. And they were like, you know, I got back problem. You know, I had this car accident. You know, I did. That has nothing to do with my household and his license and my relationship with him. So let's talk about that a little bit. Pain seeking, as they say. Yeah,
so pain seeking is a difficult thing because no one really sets out to say, well, I want prescription medications for the purpose of pleasure or getting high. Mm-hmm. What eventually happens, though, if you've been taking pain medication long enough, you need that pain medication. Your body's designed to develop what's called a tolerance to pain medication. Mm-hmm. You have receptors for pain medications that are not as plentiful on your cells the more you use them. So, you know, if I were, in my example, if I had wisdom teeth taken out and I was taking Tylenol with codeine, the first time I take that pill, it's going to be strong. It's going to work effectively. It's going to knock me for a loop. If I'm still taking that same dose a week later, it's not going to be nearly as effective. A week later, you know, my body's become kind of used to it. It's going to take a higher dose of that for me to achieve the same relief. So really, the goal for me is to get off of the pain medication as soon as I possibly can. You know, use it for the relief I need it, and when I don't need it, to stop taking it. Well, some people don't have that luxury. People that have got chronic conditions, some people have got sickle cell anemia, they have crisis spells, have frequent crisis spells. It's hard for them just to say, okay, well, let me shrug off the pain medication because, you know, I know it's bad for me. At a certain level, you need it to help get through. People that have got bad accidents, back surgeries with scar tissue from healing, it's just hard to shrug off pain medication that easily. So, but the mindset has to be, from a patient standpoint, let me get off the medication if I possibly can, or find alternatives with the help of my primary care physician or a pain specialist or something else like that. But when you reach the point where you're saying, well, I need my Vicodins to function, I need my Percocet to function, and no one understands my pain, you may be right. We're not in your shoes. We don't understand your pain,
Yeah.
but we know that you're headed down a very dark path in terms of pain addiction that you didn't necessarily intend.
Mm-hmm.
You're not getting high from it, but you need it to function and to cope, and that's a problem.
It is.
So when that occurs, that's when we start saying in medicine, what other alternatives do we have for you other than just taking a narcotic pill, which is not going to fix it, but you need more of it to function. The other question is, and my wife touched on it, what part of this is chronic pain versus what part of this has to do with more of a mental, emotional, and psychiatric component that hasn't even been addressed or dealt with. And that's what your primary care doctor has to look at when he sees you. For my issue in the hospital, when patients come in to see me, I'm at a bit of a disadvantage because if they come in with a lot of pain, the emergency department starts you off automatically with some very heavy-duty pain medication.
Yeah.
They're giving you the morphines, the Dilaudid, the heavy-duty stuff just to get you comfortable so you can, not be hitting the nurse's butt in the ER and get to the floor okay. When you get to the floor, the nurses are always begging me for strong pain medication because there are tests that need to be done, there are labs which need to be done, and some people draw a line in the sand and say, until you get my pain under better control, I'm not doing anything, and I'm going to keep on this call light for the nurse until something is done for me. So, in the hospital, my reaction to pain control is a little different. I've got to do things acutely to help you get under control so I can get some things done, all the while being mindful that I can't put you in a disadvantaged situation to be so dependent on the shots I'm giving you every 4 hours or every 6 hours that, you leave the hospital worse off with pain need than you came in with.
So for those of you joining us a little late, or for those of you catching the replay or coming in mid-sentence, we are talking about narcotics. We're talking about the prescription drug epidemic that has taken over America. I, too, have been challenged or faced the challenge of that addiction. And it was really just coming to grips with the fact that I had some serious emotional lows that needed to be addressed, not by a narcotic, but by a professional that could help me work through what I was going through emotionally. Pain is pain, and sometimes something that we're going through emotionally can manifest physically. Again, I'm going to repeat that. Sometimes what you go through mentally can manifest physically, and you can end up with some great depression that now you have ulcers, you have things with your digestion that are acting up, maybe even palpitations, chest pain. I don't even really know what fibromyalgia is, and because I don't know what it is and I've heard that some doctors just kind of diagnose you with that when they can't really identify your pain. They'll say fibromyalgia. Is that true?
For a lot of us, and I'm no expert on fibromyalgia, let me say that, but for a lot of us, it's a diagnosis of exclusion sometimes. I mean, when you've had all the tests, all the x-rays, all the sort of natural remedies, whether it's narcotic or anti-inflammatories, and we're still at a point where we're not really understanding quite why you're hurting, and you've got painted trigger points that you can reproduce on the body. People kind of label that fibromyalgia. I'm not saying it doesn't exist. I'm not saying it's not totally legitimate. I'm just saying that it's not the first diagnosis you give somebody when they come in and say, I'm hurting. You don't say immediately when you see them for the first visit, aha, that's fibromyalgia. This is how I want to treat it. You know what I mean? Because the complexity of that is diagnosing it, and treating it's hard, and getting results are very difficult.
Indeed.
So it's a tough diagnosis.
Well, Deborah says here, I think it's a great observation that you were taking the medication for emotional pain more so than physical. Not sure if anyone is looking at it that way. Let me tell you, doctors are on notice. They know, and this is why a lot of times people end up on very similar drugs that have different diagnoses, right? Because, there is no one-stop shop for what you're not willing to admit is happening to you emotionally.
Right.
And so they want to give you the lesser of whatever evil there might be. And so it seems like you've been lumped into one category. And that's just because a lot of us are not facing our emotional issues.
Let me speak to that. So it's a slippery slope for us. Number one, and let's be clear, no one wants to invalidate pain.
Yes.
And no one wants to say that if you have pain for an extended period of time, there must be something emotionally wrong with you. So let me say this first and foremost. You can have chronic pain and be the most stable person from a mental health standpoint with no depression, no anxiety, nothing else like that. It's just you've got really bad pain that we're just not controlling.
Yes.
In which case, your doctor, if he's not controlling it well or has a bunch of difficulty, needs to get you to a pain specialist to help out with that. So let's say that first and foremost.
Okay.
Let's also say this. The act of having prolonged pain can by itself trigger you to be sad and depressed. It can cause a lot of anxiety, a lot of dread. Some people can go as far as saying they have post-traumatic stress disorder from the pain they have and the events that led up to it. So as physicians, we would be remiss if we didn't at a certain point where we're continuing to prescribe medications over and over again, look at the emotional component and say, what of this could be due to something emotional going on with you, whether it's depression or anxiety. And the issue is it's a slippery slope and a stigma because people would rather have a back problem. They'd rather have a neck issue, chronic pain from whatever source, and have somebody say that they're clinically depressed or anxious. We still have an emotional stigma for that diagnosis in medicine. It's just an easier thing to say there's something seriously wrong with me, pain-wise or condition-wise, than to say, you know what, hey, I'm a little down, I'm a little depressed. It's just a tougher thing to swallow. But as docs, we've got to kind of look into that and say, okay, as I'm treating your pain, let me also not ignore whatever emotional thing you have going on. Let me ask about your family life and your personal life. Are you sleeping well at nighttime? Are you getting enough to eat? Are you crying a lot? Are you not finding joy in your normal activities? Let me factor that in as well to your chronic pain issue. Let me factor that in and see, can I give you something to help you with your mood that will also help with your pain so I don't put you in a position of facing a lifetime of needing pain medication to function. That's what we don't want.
Yeah. So for the person that is out there that feels like they have an addiction, there are definitely resources to help to support you. When you come across someone that you know is obviously addicted, how is that normally handled in the hospital? And how can one advocate for themselves so that they don't fall through the cracks?
In the hospital, it's handled. I have the luxury of having a pain specialist where I work. So he's a rehab physician, but he also handles the chronic pain patients we have in the hospital. So he's used to writing prescriptions that are reasonable for someone to have for pain control that they can take as pills at home. Now, basically, let me just be frank, he's writing prescriptions for people to be able to get off injectable pain medication in the hospital so they can get home and not have such a fall where they're going from shots, which work quickly and are very potent, to medications which are low potency, which aren't going to work and have people back in the emergency room. So he writes prescriptions to that effect. Ultimately, though, it's a complex problem where people need to either see a doctor who's really experienced at taking care of this as their primary doctor, or more likely a pain specialist outside the hospital who can manage them and over time slowly wean them off some of these narcotics. You also need a primary care doctor to look at people's situation and say, you know what if this is treatable from a medical standpoint that I haven't addressed? What's treatable from an emotional standpoint that I can address so that I can use a multi-pronged approach to helping somebody who might be addicted to narcotics? And keep this last thing in mind. Pharmaceutical companies make a lot of money off of pain medication. It's a $1 billion industry for a reason. It's because there is a physiologic component to why you are dependent upon narcotic medication. So, they're not going to be the answer to your problem. They're going to give you the relief that you need, but ultimately, they're in the business of making money. And that's why so many doctors sometimes can get into trouble who are giving out narcotics freely and not kind of checking to see the patient's narcotic histories and other things that we're required to do nowadays. Because there's money in narcotics, money just financially in a capitalist country. You can make a lot of money prescribing it, producing it. So no one who's designed to make money on this is really aggressively trying to get you off the narcotic medication. It's just assumed that we as doctors need to prescribe it responsibly. But sometimes it's difficult and people can be on the same Percocet, which helps them function for a decade, and that's tragic.
So I want to kind of pivot to the long-term effects of being on any type of medication, not just narcotics, but because we're talking about narcotics, what organs can you damage along the way with prolonged use of something that you just really shouldn't be on for a long time?
A lot of it depends on how it's metabolized in your body. So, high doses of certain medications like acetaminophen types will give you liver issues. You can have issues with your kidneys. There are long-term ramifications, but of a bigger nature, narcotic medications, if you take them long enough time, require higher doses to get you feeling better. People have been known to overdose, taking too much in the way of narcotic medications. It's cause mental health issues. So, anything that you need to help you get started for the course of your day, which has potential to alter your judgment and your thinking, is not something you need to be on long term.
Indeed. So we hope you have enjoyed this very short offering this week. We see that a lot of people came in and then checked back out. We see that we still have a few people here with us. Hi there, Daisy. Hi, Rob. Hi to all of you that will join us. Again, we will be doing this weekly, regularly, we'll say, because we want you to become your best health advocate, because that's what it really is all about. You need to manage yourself better. And I think the way I was able to come off of the narcotics, of course, tapping into my faith, an improved diet, better exercise, drinking more water. I even took the time to fasting and praying, meditating, talking to people, being more open about what I was going through emotionally. So open that some people were getting tired of me, weren't even picking up their telephones anymore. However, I got the help I needed outside of that narcotic, y'all. And I'm telling you, it is difficult. It is challenging, because I went from the narcotics, from smoking cigarettes and weed at times as a young person, and popping pills and drinking, to eating. And to that eating dysfunction. A lot of times when people get off of their drugs, off of their various addictions, they go to another addiction. And so that's what my problem was, hence having ultimately the weight loss surgery. And it's been slow going because I am still very addicted. Some of us have addictive behaviors or addictive personalities. And so I'm by no means judging anyone that is experiencing this type of addiction, because I know firsthand how challenging it can be to get delivered from these situations. But we want you to be encouraged, to know that you're not alone. This is a widespread epidemic, and there are stories of individuals coming off of those drugs successfully and becoming very healthy, and even saving themselves from an impending disaster as a result of being on those things long term. So thank you, Lamont Ellis.
It's my pleasure. By the way,
yes,
I'm always happy after the Raiders win on Sunday.
Oh, my goodness. He is a Raiders fan. In fact, that's why we're going to London, because he chases them wherever they go. You've been to London a few times to watch the Raiders games, and you've been to Mexico, and where did you want to take me? And I was like, I'm not going with you.
Mexico City.
Probably Mexico City. Yeah, I'm like, nah, I'm chilling.
You
they had just had a major earthquake. And
you thought they were going to harvest your organs. So.
And they want to harvest my... No, I'm not. Listen, bottom line is we're here to support you, to answer your questions. Don't be afraid. If you just want to inbox in confidence, please inbox me, and we will address it, and we won't even tell who asked the question. But you can get your answers from this man here, who is trained and licensed and has been practicing medicine for over 20 years. So thank you so much for joining us. I'm Toni Ellis, and I want you to get sparked in your health, to be more healthy. That means to consistently show up, own up, act up, so that you begin to rise in your health. We want to improve those numbers. We want to improve your cholesterol. We want to improve your blood work. We want to improve your bottom line for your A1C. So I want you to also be resilient. Understand you can bounce back. Be optimistic. Hold yourself and others accountable, and be restored. Until the next time when we join you here for Medical Mondays with Monty, peace and many blessings. Share this post. Love you for real, y'all. Bye-bye.
Goodbye.